So let me just ask you a little bit about more specific about the Newbie. So how do you use in your practice, and what are its applications?
Sure. First and foremost, it's a Class 2 medical device that's FDA cleared as a Class 2 medical device. And the FDA actually cleared it for very specific things. I'm just going to kind of read off the list for maintaining or increasing range of motion, increasing local blood circulation, neuromuscular re-ed, which is one of the things which is key from a standpoint of, what are we actually doing with the patient, preventing atrophy, reducing spasms, preventing DVTs after surgery, and managing acute and chronic pain post-surgical. For musculoskeletal injuries, it's better than anything I've ever seen. We go through a process called mapping, where I teach the people I train in using it that, let's say somebody has a shoulder issue, you map with the electrodes, with a pulse direct current with each electrode, and you find the spot where the patient feels it the most. We call it mapping. And so we know that unequivocally, those are two spots where there's probably sympathetic nervous system tone, where it's probably the cause of whatever dysfunction, whether it's pain, weakness, injury. And I'll give you a really good example with that. A patient that we as physical therapists probably dread seeing the most walk through the front door is that person that's a former patient. The spouse calls you and says, my husband bent over to tie his shoe, and now his back's been locked up for 3 days. He's been in the fetal position on the bed because his back locked up. Still in the fetal position, but somehow his wife finds a way to prop him in the car, bring him to you. He walks in looking like 𝐏𝐨𝐝𝐿𝐬𝐭, right? He can't even stand up past looking at the ground. And in my history of practice, I've never been able to get that person leaving on that day, walking upright. I'm thinking, man, I could put a hot pack on you or a TENS, unit and kind of wiggle your legs around a little bit, but you're still going to be walking like 𝐏𝐨𝐝𝐿𝐬𝐭 when you leave because it's so acute. Go to the hospital and get a Toradol shot or something, right? That person every single time will walk out completely straight just by going through this mapping process and doing just some simple movements. I know the most skilled manual therapists that have a gazillion years of training that know exactly where to find it, which is 1 in a million, probably can get them walking straight, but the average physical therapist that doesn't have that skill set can't, right? And so that's just a good example. From a standpoint of neurological conditions, we have MS patients. Dr. Terry Walls is a pretty well-known physician that is a champion for MS. She incorporates the Newbie in all of her protocols. We'll have patients that travel to us or travel to Austin, Texas that haven't been ambulatory for a really long time, and after spending 2 weeks with Newbie protocols, they're able to walk around the house. It's crazy how good it works. We're an outpatient orthopedic practice, so we're not really the appropriate spot to see like a CVA patient, right, that has an arm that doesn't work, that's in flexor tone. Well, we've had referrals like that. We have one patient in particular that had a stroke 2 years before he found us. He had flexor tone, no functional use of his left hand. Applying these basic principles with the device within 2 weeks in an orthopedic practice where we're not really experts in neuro anymore, right? There's places that do that. Just by going through this process within 2 weeks, he was able to give a thumbs up. And within 3 or 4 weeks after that, he was able to hold on to a glass of water and actually drink with it, where he had an arm that was non-functional. I trained one clinician, his name's Leon Anderson, up in Ohio. He's got 3 or 4 practices in Ohio, and he came to Florida in 2019 to train, brought it back. Within the first 2 weeks of having the Newbie in his practice, he called me and he literally was like, very emotional, like tears in his eyes on the other end of the phone. He's like, Jason, I had my first miracle. I have a patient that I've known for 20 years, had a stroke 10 years ago, no use of his arm. He's actually able to use his hand now. He's like, I don't know how this happened, but it's like unbelievable. So stuff like that is what kind of moves me to kind of keep training people, because you never know what's going to happen. And then I mentioned earlier, the autonomic nervous system. We really found out by accident that it absolutely has a positive effect on the autonomic nervous system. We use a system to measure HRV, heart rate variability, and if somebody has low HRV, they're stuck in like a sympathetic, autonomic nervous system response, that stress response. If they have a high HRV, they're in that like autonomic parasympathetic, which is the rest and reset. So we know that the Newbie, specifically with protocols, can switch people out of a sympathetic nervous system bias and more into parasympathetic. And some of the clinical implications of that are just with stress, whether you're getting ready to take the SAT test or you're a corporate executive that's really stressed out, it absolutely helps with that. immune function. There's studies that show it absolutely affects the immune function of your body. And then just with athletic recovery, a lot of us that work with high level athletes, if they're overtraining, we know they kind of get in burnout mode. Put them on this HRV device, their HRV is really low. You just go through 20 or 30 minutes on a master reset protocol on the Newbie device, and we can kind of shift them significantly more toward parasympathetic. So that was something that by just tracking HRV, we're like, oh, it also does this, and it's done this like thousands of times now. Okay, let's write a protocol about it. So that's how those things kind of develop.